Thank you very much. I have been asked to discuss the acquisition of competence in managing bleeding robotically, and specifically HPV surgery. I don't have anything to disclose. I wanted to break it down into really five steps or 5 pieces. And the first one applies to open surgery and robotics, and that's exposure. In robotics, we have 4 arms. That 4th arm is often used as a static instrument and just used for retracting the liver, retracting a portion of the liver. I think we need to very much be cognizant of using that arm both to expose, but to offer traction, offer tamponade. Multiple people today have said, use that extra port when you need it, use it as a support, use it as an extra assistance. The assistant has 2 hands, so why can't they use both of them? And then smoke evacuation. If you have a smoky field, you cannot do a proper parenchymal transection and really avoid the bleeders prior to them happening. We have in our institution usually an air seal or the Alessi smoke evac. I like the Alessi smoke evac because it has an extremely low profile. It's not in your way. Our urologists like to use the 5mm port that comes with it. And more and more I'm doing that because it just facilitates the evacuation of smoke and optimizes your exposure. So the best way to avoid bleeding is or to control bleeding is to avoid having it. And so becoming facile with the laparoscopic or robotic ultrasound is really key. And then if you do have a bleed, I think the ability to utilize the Pringle already set up in cases where you think it's potentially more higher risk. I like to have it completely intra-abdominal, and I think it just gives you one more layer of safety for controlling bleeding if it were to occur. And then again, using the 4th arm for compression if there is especially venous bleeding, hepatic vein bleeding. So being really familiar with the available energy devices, you guys all remember the Habib back in the day, and Dr. Wakbash, she talked about ablating the parenchyma prior to transecting it. We don't do that anymore, but I think most would say, we use the fenestrated bipolar and the vessel sealer extend most often, the Maryland for more specific hemostasis. The Aqua Mantis and the Argon Beam Coagulator, I like the Aqua Mantis in that you can get hemostasis on more profound parenchymal bleeding, but it requires a 12mm port, and the laparoscopic one doesn't have a very long arm, so it has to be pretty close to the liver parenchyma if you want to use it for hemostasis. My Boston partner likes to use the Argon Beam. And then most recently, the Da Vinci SynchroSeal. I just recently used this on a patient that was a little bit cirrhotic for an HCC, and it's a bipolar energy device, and it's 8mm, got the 60-degree wristed articulation. It uses the same generator as the vessel sealer extend, and you can use it for grasping, dissecting, sealing, and transecting your tissue. The caveat is that it's designed for a 5mm vessel as opposed to a 7mm vessel, and so that is a limitation. One thing I did like about it is that if you put it open against the parenchyma, it acts like a bipolar device. And so it really was able to get very good hemostasis on a very kind of a rigid liver, very rigid liver. Suturing setup. So practice. Practice in the dry lab, practice on the simulator. The SimNow is the new simulation platform from Da Vinci. That is great for mastering needle dexterity. I like to have the pre-cut suture up as well, and I will have a needle driver open on the field, both laparoscopically and robotically. You're just ready if there is a problem. These are the new skill exercises on SimNow. And then if you are, you want to practice in the lab, you want to practice on the simulator, but you don't want the next step to be a giant hole in the right hepatic vein. So let's bridge that gap, and one way to do that is, as an HPV surgeon, I'm not doing colorectal cases, I'm not doing paraesophageal hernias, but I am doing my own ventral hernias. I have a few of those, and so it's a very nice way of practicing suturing and needle dexterity, and also time, like practicing your speed. So, and certainly cholecystectomies. So thank you.